Did you know that every year, well over 250,000 breast augmentation procedures are performed in the United States? I didn't know that. And every year it is rapidly growing and increasing by the tens of thousands. So I am here with board-certified plastic surgeon, Dr. Andrea Martin, to discuss all things breast augmentation. Thank you so much for taking the time.
Yeah, thank you for having me.
Yeah, is this one of your favorite procedures?
This is my favorite procedure.
Yeah.
Yes, I love doing breast augmentation.
Why? Tell me.
I just think it's something that's, the surgery itself I think is really fun and gratifying, and patients are so happy.
Yeah, I could imagine. And it's like overnight,
Yes.
right?
Yes.
So who's a good candidate? Who should be getting breast augmentation?
Ideal candidates are at a stable and close to their normal weight and want some kind of enhancement in the size of their breasts.
Wonderful. Is this what you would typically be putting into somebody? Like, walk me through the procedure, and what does that look like?
Yeah, so a breast implant is like this. Often it's filled with silicone or saline and has a shell that's made of silicone. And during the procedure, there are different ways to approach putting in the implant. My favorite way is using a small incision right above the breast fold at the bottom of the breast, and sometimes you need to lift up the muscle, sometimes you don't, but you'll place the implant through that small incision that's only about less than 2 inches sometimes.
Wow.
Once you place that implant, you sew it back up and the patient's done.
So the recovery, so you're making this little incision underneath the breast fold, and how long is the recovery?
It varies from patient to patient and what specifically you're having done with your breast augmentation, but between 2 to 4 weeks patients can expect. That doesn't necessarily mean you're down and out for that 2 to 4 weeks. A lot of patients are back to work within 1 week.
Wow, that's amazing. So do you need help during that recovery, or are you okay by yourself?
Yeah, I would definitely encourage patients to have help around the house, at least for the first several days, if not full week.
Wonderful. And oftentimes mothers ask me if they do decide later in life to have another child after breast augmentation, will it affect their ability to breastfeed?
This is asked all the time. No, it doesn't affect your ability to breastfeed.
Sweet. Not that I'm planning on having any more children, but if a patient does decide that they want to remove the implant later down the road, what can they expect their breast to look like?
That is really variable from patient to patient and depends a lot on the size of the implant that you had. It does take a little bit after you've had your implant removed to determine how the breast skin is going to retract. So some women, after they've had their breast implant removed, feel like their breast still looks a little bit low and they want to have a breast lift. Sometimes patients want to do that during the same surgery, which you absolutely can do.
So you can combine breast augmentation with other breast procedures?
Absolutely.
What are the most common?
Breast lift with a breast implant placement. That's probably the most common, and that's really a good option for women who've lost that upper pole fullness in their breasts, whether it's most commonly from breastfeeding, but even if you've had a lot of weight loss, that area tends to just deflate, and a breast implant is excellent to treat that area.
Well, thank you, Dr. Martin. I think you've answered so many amazing, tough questions. Book your consultation today. Meet Dr. Martin. Find out if breast augmentation is the right treatment for you.